Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hey friends, I am so sorry. It has been a minute for me. This is a first. I have not missed the podcast for more than 1 week in a row ever. And with it being Maycember is what we're calling it. May has just been chaos with all the end of school stuff, and we've had some illnesses. I had my own injury, kind of tweaked my back. It's been a little chaotic over here to say the least. And so I have skipped the podcast for 3 weeks in a row, and it hurts me so bad because I was doing so good on being consistent and showing up, even if it was just a little something for you guys. But it was honestly just too much for me right now, and I had to give myself the grace and capacity to just let it go for a minute, knowing I was coming back with lots more goodies for you guys. So with that being said, I do apologize if you have been coming on looking for something new each week and getting bummed out that there's nothing new there. But more is coming, and I've got something so exciting for you guys today because I have such a special guest on the show. Tami Stackelhouse is an award-winning author, founder of the International Fibromyalgia Coaching Institute, and executive producer of the fibromyalgia documentary Invisible. And Tami teaches fibromyalgia patients how to take back control of their lives and health using her signature Fibromyalgia Wellness Framework. She is also the host of the Fibromyalgia podcast, so they can break free from the prison their bodies have become and begin living their lives they love. And I just love this because fibromyalgia is something that, especially as a PT, we're kind of taught as, it's a chronic pain condition. These people are extra sensitive. It's this whole body thing. Maybe it's in their heads, right? Like there's so much messaging around chronic pain, especially fibromyalgia. And I just know after working with this population and really understanding more about the nervous system and pain and chronic pain and how the body holds trauma, like this is not a fake diagnosis. This is not a, oh, you're crazy, it's all in your head thing. Like this is actually a physical body thing and a mental health piece. Like, yes, this is a whole body disease, but it is real, and we do need to take it seriously so that there can be more research and awareness and resources out there for these people. Now, I'm so excited for you guys to hear from Tami and learn more about what fibromyalgia is, how it shows up, and some of the tools and resources she has for you guys, because this can be a very frustrating and debilitating condition, but you are not alone. And so if you know someone someone with fibromyalgia, or you have fibromyalgia, or even just chronic pain, this episode is going to help you. And please share with those that you think would be would benefit from this information, because again, I think that fibromyalgia is too misunderstood, like so many other conditions that women deal with. And so I love having Tami on and people like her to help break through those stigmas. We are all about helping educate and empower and inform all of you women out there so that you know what decisions to make about your body, and that you don't have to be stuck, right? We can get so stuck, especially in the Western medicine model. And so I'm so excited for you guys to learn more from Tami. We're just going to dive right in. All right. I am so excited to have Tami Stackelhouse here on the show to help my listeners learn a little bit more about fibromyalgia. It is something that is a lot more common, I think, than we realize, and a lot more misunderstood than we realize. So I am so happy to have Tami here to help break it down for us. Tami, I'm just going to let you take the floor. Give us a little introduction. How did you get into doing the work that you do? Who are you? All those amazing things.
You bet. So, yep, I am the founder of the International Fibromyalgia Coaching Institute. I do the Fibromyalgia podcast, wrote a couple of books. So clearly fibromyalgia is my topic, as I say that word over and over. And I think, like so many of us, I got into this because this was a problem I was struggling with, right? I was diagnosed with fibromyalgia in 2007. I had only been married 6 months, which was a whole other thing. And, just it was so hard to find good information. Interestingly, right around the time I was diagnosed is when the first medications for fibromyalgia came out. So it's really like fibromyalgia itself is very, very old, but treatments have not been around really all that long, which is kind of stunning. So there wasn't a lot of support, a lot of help. Fortunately, I found the right doctors and was able to get better. But a huge part of that for me was finding a health coach, working with her. She didn't know anything about fibromyalgia, but she still was able to, she was somebody I could bounce ideas off of. She could hold me accountable, like all of that. And it was such a help that I really just wanted to pay that forward and help other people in the same way, and add to that all the things that I had learned in figuring out how to manage my own fibromyalgia. So that's kind of how it all started.
I love that. You're so right, though. We get into, I think, these specialties because it is something we were already kind of dealing with. I had a very similar story with mine because I wanted to do PT, but I did not necessarily want to do pelvic floor PT and, be a vagina doctor. That was not necessarily my dream. And it still wasn't even after PT school, but I was like, oh, cool. You mean I don't have to pee my pants anymore? I guess I'm going to try this and put it to the test. And then it wasn't until realizing how life-changing that really is, and then seeing that represented and also underserved population of women, that really kind of gave me that responsibility in a sense. I know all this stuff now. I need to, give back. And after having it heal me, I need it to heal other people. So it really is. We just get pulled into what our body needs, and we use those tools to help others. So I'm so grateful that you did that, because I was mentioning to you before we started the recording how, going through PT school, fibromyalgia is kind of that diagnosis that's those patients with a lot of pain, they don't really know why they're in pain, they just have a lot of pain, and we take it with a grain of salt. It's kind of just this population that got pushed into chronic pain, and I hate to say written off, but in a sense written off.
Oh yeah.
It's okay, I can't necessarily put as much focus into every single area you're talking about. So let's just kind of try to narrow it down to one space. And I think that does the body a disservice, especially someone who's dealing with fibromyalgia, because it is such a systemic thing. And so I'm just really glad that you're diving into, not only what it really is and how we can really help people, but also educating and helping the big culture as a whole really learned that this is a legit issue, and this is something that we need to really take seriously. I've had my own issues health-wise that have been so humbling to kind of realize how easily women are written off and just kind of like, oh yeah, you're in pain. And not to say men don't have fibromyalgia, but I mean, you can get into those stats. I'm sure women are definitely the predominant population there. But I guess with that being said, let's dive into some of the basics. Like, what is fibromyalgia? I would love to know too, just because obviously, you know, when I went through PT school, like, gosh, already 10 years ago, I'm sure the definition of it has also changed. So what is it? How does it present? What are some of these basic things that we can learn a little bit more about it?
Yeah, absolutely. So it's so interesting that you said what you said about like people being sort of brushed off. You can actually find the first description of fibromyalgia almost 200 years ago in medical literature. And at the time, it was kind of considered a psychosomatic illness, that it was something that was happening in your head, right? That you were a hypochondriac almost. Not that it wasn't real, right? But just that it was happening up here. And, you know, they would do biopsies of the muscles of people with fibromyalgia and everything looks fine. You do lab results, everything's fine. X-rays, everything's fine. So it is a good question. What the heck is fibromyalgia? We can't see it. We can't find it, but yet it's also very real in our experience of it, right? So there are 4 main symptoms for fibromyalgia. There's a whole lot of other things that can go wrong too, but the main symptoms, the first one, of course, is widespread body pain. Some of the characteristics of fibro pain versus all the other kinds of pain we might have. One of them is that our pain moves around. So if you just hurt in just one place and it's just that all the time, it may or may not be fibromyalgia, but that's less likely to be fibro. With fibromyalgia, we might have our legs hurt one day and then our back hurts the next day and then our neck and then our shoulder. Like it just kind of moves around. The other aspect of fibro pain is that fibromyalgia is an amplifier. So if you have something that hurts, like let's say you've got a bad knee, that bad knee is going to trigger pain everywhere else, right? Your whole body might end up hurting because your knee started hurting. And your knee is probably hurting worse if you have fibromyalgia than somebody who doesn't. So that can be a real challenge for people, right? Like going to PT, for instance. Wow, that exercise shouldn't hurt you as much as it did, or that injury shouldn't hurt you as much as it did. Right? That's the fibro amplification effect. So widespread body pain, that's number 1. The second one is fatigue. And this is more than just being tired. I think of like regular fatigue and then fibro fatigue and then chronic fatigue syndrome.
Yeah.
That's a whole nother level even from us. But I think of our energy levels like those old cell phones you'd charge and they would say they were full, but they might only last 10 minutes or something. Right? So we do have mitochondrial dysfunction, right? Our cellular batteries really are broken. They don't work the way that they should. And so our energy levels are much different, which again plays into, you go to a PT, I can't do all those exercises, even though it looks like I should be able to. I actually had one of my clients tell her physical therapist, she said, okay, I know what you're asking me to do and I can do them. But if I do that, I will not be able to drive home. And that's a good example of just that energy level is so different. Then we also do have brain fog, all the cognitive dysfunction, and bad sleep. With fibromyalgia, we have higher incidences of things like sleep apnea. It's actually 45% of people with fibromyalgia have sleep apnea. Yeah, and like the normal population, normal quote unquote population, non-fibro population, it's like single digits, right? So that is huge difference. So, and other things going wrong with sleep too, but those are the big main symptoms: the widespread body pain, the fatigue, the bad sleep, and brain fog. So having those things then, I mean, as I'm describing them, you've got to podcast and you're working with a lot of women, like I bet everybody's like, oh, I've had those.
Yeah, exactly.
You've been there. So I think it is also important to talk about the differences. So I think the main difference is, one, fibro pain moves around, and two, that amplification effect. So if you ever feel like, oh gosh, things just hurt me more than they hurt everybody else, or if you have other people like, I didn't hit you that hard or whatever, right? That is that amplification effect. And that does point a little bit more towards fibromyalgia.
Yeah. And I think, that makes me wonder. So, and I don't know if you know this off the top of your head, but is there like risk factors for fibromyalgia? Like who's at greater risk for getting fibro? Because hearing those main symptoms, I have certain things pop off in my head of like, oh, well, that sounds like, so I'll say fascia. And we might get into the research a little bit on that. I'd love to know, as we get into our chat, some of those things, because my brain, obviously, like, I think there is no, like, I'm not invalidating, like you said, like it could be the brain causes a lot of things in the body. Like you can manifest autoimmune conditions, like you can cause a lot of things. So just because it might be all in your head, I mean, that's the conversation we have with chronic pain patients, right? Like we know the synapses, the actual physiological changes that happen in the nervous system with chronic pain, and all of these changes that are actually happening. So it's not fake, but that reality of, your brain, yes, could be causing stuff. But I also immediately think fascia, just because of all of those moving parts. And, and that's always kind of been my own understanding, going through PT school, we get a little bit on fascia and stuff like that. But even in PT school, they're like, yeah, there's this fascial tissue. And I hope that's changed, because we have learned so much more about fascia than I learned in PT school. I don't want to get too much on a tangent, but I guess with that being said, are there any main risk factors or big risk factors or correlations of people that do have fibro versus people that don't?
Yeah. So there is a genetic component, because we do see higher incidences of fibromyalgia in families. So you're 8 times more likely to have fibromyalgia if you have a first degree relative. So parent, child, sibling. So we know there's a genetic piece. We also know that there's usually some kind of trauma trigger, and that trauma could look lots of different ways. So that could be, you get the flu and don't recover. It could be a car accident. It could be abuse. There's higher incidences of fibromyalgia with people who have a higher ACEs score, right? The adverse childhood experiences. All of those things are factors. In my case, it was a very stressful job. Chronic stress is its own kind of trauma, right? So the way I personally look at it, and I don't think we have the research that totally proves one way or the other, but the way that I see it is we have this genetic predisposition. And depending, if you go through life and you have a nice, calm life, you don't really ever get that sick or that injured, you might, get through without fibromyalgia manifesting. But for a lot of us, we have something happen, and that's just the switch that gets turned on. And then that's when we experience symptoms.
And so to clarify, would you call fibromyalgia an autoimmune condition?
Good question. There actually was some research done a few years ago where they took human antibodies and they put them in poor little mice. But this is how we do medical research.
Yes.
And those mice developed fibromyalgia-like symptoms. So there does seem to be the immune system is involved somehow. We don't know exactly how. Like that's just the first little clue that now we have to, chase down that path and see exactly what that means. So the immune system is absolutely involved somehow, but I don't know that we're at the point where we can definitively say this is autoimmune.
Yeah.
period.
Well, and just hearing how it manifests, like hearing there's a trigger, right? Like that's immediately to me is like autoimmune, like, or something in the body got that tapped out. I'm always talking about this threshold in the body, this capacity that our body has, whether it's stress, inflammation, which inflammation is like a stress, right? Again, you talked about stress, and I talk about that in my podcast and with patients every day, all the time, because I don't think we really understand the true impact that stress has on our body, and that it can be in the form of someone yelling at you, having a big to-do list, hurting your arm, eating food your gut doesn't like, not sleeping well. Like there are so many forms that stress can start to just tax on our system. And I feel like, I like to explain it to my patients like a bucket, and everyone's bucket is already somewhat full. And so some people, and I do kind of lump people with fibromyalgia into this bucket where it's pretty full, right? So one little thing can set that flare off and set the system off where now you've got that big fatigue flare or that pain flare. And so regardless of whether it's actually true autoimmune or not, we do want to think about this like really anything else that is autoimmune, and even just inflammation in our body. Like what is that threshold, and seeing this bigger picture of it, and not just thinking how much exercise did I do, right? Like maybe it's I didn't sleep very well, so today's probably not the day to go do that big workout or whatever. Like really looking at that whole capacity of the system. And again, I think it will be interesting to see more research done to really see like what is driving and causing this. Because again, hearing your and this is what we did learn in PT school, that it's kind of, it moves around. And I think that part is what makes PTs go, okay, it's not musculoskeletal, right? Like, then that's not what we want to focus on. We just want to focus on the muscle that doesn't turn on, the joint that's stiff, the nerve that doesn't communicate well, the nerve that's entrapped, the alignment, like these structural physical parts. But we do forget about the big reality of the fascial structure, because fascia is one connected sheath from head to toe that has systems within it, but it is all connected. And so I've always kind of been one of those PTs that maybe you consider woo-woo, because it's like, it still makes sense to me. I'm like, yeah, sure. Maybe they're moving their neck, they feel it in their hip. Like, and then the PT goes, well, that's weird. I'm like, not really though, because we do have this connective sheath. And so my own hypothesis about fibro is that it is a fascial dysfunction, that it's more how the fascia is being communicated, even maybe from above, right? Like maybe your brain and that nervous system piece is controlling how your fascia is responding to these triggers. And that's kind of just been my own, call it scientific / clinical, understanding and approach to fascia, because I do think there is a physical piece. I think we can give people a lot of relief by working with the body in a gentle way, and also getting, just as much or more relief if we also bring in that brain-body connection, and then nervous system down training and trying to calm the body as a whole. And so I think it is, I personally, have always enjoyed working with patients with fibromyalgia. I think that it's something that, again, these women come to me that are very frustrated. And so it's good to kind of see them getting some hang in quality of life and improving function. But I would love to know, like, what are some of your strategies for navigating life with fibromyalgia? Like, how does that look in reality? And how are you navigating not only obvious things like exercise, but like even just daily tasks and responsibilities?
Yeah. Great question. Because that's really what it's all about, right? It's not about necessarily having a body that hurts or doesn't hurt. It's about how that pain gets in the way of you living the life you want to live. So exactly. I think it is really, really important that we get people back to doing some of the things that they love to do, because we tend to do the have-tos
Mm.
right? And then we lose all the joy in life. And I think fibromyalgia can feel like a really long taking away of things, right? Loss of function. Sometimes it's a loss of career or hobbies or even friends and relationships, even just the simple joy of food you like to eat, right? It
Yeah.
can feel like everything's being taken away. So we really have to purposefully add that back in. So when I'm working with clients, I like to work kind of from three main areas. One is the physical. What is actually going wrong in your body? That might mean, you had an old injury that didn't get rehabilitated properly, and we need a PT to help fix that. It might be hormones that need to be adjusted. There might be other conditions that you have that just aren't well managed, right? So maybe you have migraines, but they haven't been managed the way they need to. And really looking at what's going physically wrong in the body with fibromyalgia, but also everything else that's contributing to it. I also want to be looking at the lifestyle piece of things. That's us taking care of ourselves, right? That's how we eat, how we move, that's our sleep hygiene, all of those kinds of things. And then the third piece of it is our mindset and how we think about our illness, how we think about our pain, even just how we think about our own bodies. So within that, of course, there's lots of things in all three of those, but that's sort of the big picture overview for how I approach things with clients. And it is really important because fibromyalgia is that amplifying pain, amplifying fatigue. It is really important that we track down the other things that are going wrong, because if there's no volume to turn up, right? If there's nothing to amplify, then that
Doing okay.
makes a better pain level, right? So I absolutely think there's a place for all the things, right? I think for me personally, just thinking about my own life, one of the big things was improving my sleep. So I discovered I was one of those almost 50% that had a sleep disorder. I don't have sleep apnea. I have something called upper airway resistance syndrome, but basically sleep apnea. I discovered I was waking up 45 times an hour, which is once every 80 seconds.
Oh my gosh, you're not sleeping.
No, that is not sleeping. Is it any wonder I was tired? Is it any wonder I hurt or couldn't think? Of course.
Exactly.
Duh. So that's a real easy, big, and a very medically normal thing to get diagnosed, and there's treatment for it and all the things, right? So that was one of my big step up when I got that figured out. Another thing for me was hormones, adrenals, thyroid, progesterone, estrogen, all the things, right? And really getting those where they needed to be, because after years and years of chronic stress, needless to say, my adrenals were not doing what they should be doing when they should be doing it. So that was a big piece for me. And then I don't like the word pacing, but pacing. The way I like to talk about it is budgeting our energy the way that we would budget money. So really being not in denial, being realistic about how much energy I had every day, and then trying to live within that and making smart decisions on how I was spending that energy so that I could spend it doing the things I wanted to do, not just waste it on all the things and then realize you have nothing left. Sometimes there's things you have to do that you don't want to do, right? But still being able to budget for that and being smart with that really helped to break that cycle of doing all the things and then crashing so hard and not being able to do anything. And once you can break that cycle, it's so much easier to live your life because your energy levels then become a little bit more predictable. Your pain levels become more predictable. And it's a whole lot easier when a friend calls you up and says, hey, do you want to meet for coffee next week? You can say yes or no and not, I have no idea how I'm going to feel. Right?
Yeah. which in itself, I'm sure is so frustrating when you just wake up day after day, or you wake up thinking you're feeling good, so you go hard. And I can imagine just, relating fibro to patients that also just have injuries where it's like things are flaring. It's like this process of, oh, I feel good, so then I do way too much. And then the next day you're like, oh my gosh, that was way too much. And so it's kind of assessing. And I have this talk with all, especially, I work a lot with moms and postpartum women and stuff where the body is healing and there is this energy deficit where like I felt good, so I went on the walk and then I was wiped for like a week. And it's like, yeah, because one, your body's still healing a massive wound, right? Like there's all these reasons why the body might be low on energy, but really looking at that whole capacity, like you said, like seeing that bigger picture and taking that control back so that you're not just reactive, kind of going through the day to day. I love that you bring their joy back, because that's also like, again, working with these moms, it is so easy to put yourself last. It's like, oh, the dishes are there, the laundry's there, the kids are here, like everything's in your face needing to get done. So it's go, go, go. And then by the time there's any time for your brain to think about you, your body's like, but we already gave all we got. Like, this is it, we're done. And then you're on the couch, like mad at yourself because there's another day that you didn't exercise or do whatever you wanted to do. And I think that, it took me a long time myself personally, even being someone who loves exercise and is really active, having kids, it's a roller coaster of being active and then not. And it just felt like this like cycle. And I was so sick of it. I wanted it like a lifestyle, right? It's like, I don't want to be at the gym for 3 months and then not at the gym for 3 months. Like I want it to be like sustainable. And I couldn't figure out what it was. And for me, and what I found with patients is that we do have, and women, I'll just say women, because we do, especially moms, have the tendency to not only put everybody in front of ourselves, but you're so go, go, go with thinking you're going to prioritize yourself. And then again, you get to the end of the day, the week, the month, and you didn't. And it's like, well, why are we frustrated? We're not doing what we enjoy. And maybe that's not exercise for you. Maybe that's sitting and reading a book. And that's what I'll tell my patients. Like, it doesn't have to be this perfect scenario where kids asleep and we have an hour to do something. Like, really just trying to build in 5 minutes of time for you is so crucial, whether it is reading, sitting in the sunshine, talking to a friend, listening to music, working out. Like, I think prioritizing that time for you first is so crucial, because then you spend that 5 minutes on you. And yes, I think everyone deserves at least an hour, but let's be real, that's not always our reality. And if we can even just get in 5 to 10 minutes, then we can go do the dishes and go do all these things and be like proud, like, I already did me, like, this is good. And then if you're too tired to do the dishes in the evening, oh, well, they'll be there tomorrow. But also, you're probably still going to do them anyways, because you're going to power through. You don't want to see the dishes in the sink, but you're not going to power through and do your thing. You're just going to lay there on the couch if you put yourself last. So my thing is always put yourself first. And it can feel so uncomfortable for women. It's like, why am I not doing this? It's like, because it's not a priority. Like, we don't want to put that as a we don't want to say that's the excuse. It's like, well, I'm showing up here. What do you mean? I want to do it. But it's like, but your actions aren't showing that priority, right? And sometimes we have to have that hard inner look of like, what is it that I love to do that I'm not doing anymore? And why am I not doing that? Like, oh, is it because I have no time? Because that's excuse number one. And that also is an excuse, because it's where you're prioritizing your time. I bet you're scrolling for at least 5 minutes a day, right? Like, take the cell phone scroll away and there's your time. It's just where you're prioritizing that. But I think that mental piece is so powerful, because if we feel reactive and stuck in that process of what's in my face, the pain's in my face, this chore is in my face, I can't do this, that's in my face, right? And it's just like, it feels so overwhelming and frustrating. And I am sure it feels so much more empowering to be like, hey, tomorrow, I don't have much lined up. I will feel good tomorrow. I can do this tomorrow. And even fibro or not, I think looking at our life that way, where we're not just tapping our capacity out, like, spread things out. Pressure and hustle culture is dead. I think that it is so important to prioritize rest. And as women, I think that is a struggle. We do not
feel like rest or breath work is productive. And it's like that can be the game changer in your pain, but you're not taking the pause to calm your nervous system, to refill your cup. And then you're wondering why you're running on empty with flares every day. And so I'm sure obviously it's easier said than done when you're dealing with pain. I mean, I don't in no way live with chronic, so I did have my own pelvic issues this last year where I got my own taste of pelvic pain for a few months in a chronic sense. And I was like, this is very humbling and very frustrating because it's like one day I'm feeling good, so I'm pushing it. And then that night and the next day I'm paying for it. And it was just so frustrating, even being, a physical therapist and a body worker and feeling like I should know these things. But then it's different when it's you in your own body feeling like you're trying to listen, but you're also trying to do what you should be doing. And I think that it really does come down to honoring your own body and listening to your own body and actually doing what your body is asking of you. And maybe that's taking a break.
Yes. Oh my gosh. And we live in such denial too. I think we're either looking back at what we used to be able to do, right? Well, I should be able to do this because I used to be able to do it, right? Or we're looking ahead for what we hope to be able to do. And I think we have to somehow walk this fine line between acknowledging the reality of the body that you live in right now, today, what that body's needs are and limitations are, and being honest about that, and also holding out that hope for something better. Like we can't have one or the other. We can't totally live in the future and be in denial, but we also can't just be stuck in today, because then we're stuck, right? We are here to get better. So we do need to be looking forward, but that can be such a tricky balance, right? Because it is so easy to not hold those two things at the same time.
And it's exactly that. I'll get women coming in being like, well, I can't run anymore. And they're not running, which I'm like, especially with running, I'm like, okay, let's stop the running. But how do we get to running? Because you're not going to just do squats and all of a sudden be able to run, right? Like there is this in between. And that's where, it can be, for me at this point, it is very simple. I'm like, let's break down the movement. Like, what can we do? But for me, it's every day I'm thinking about these things. And then I have women come in and it is not simple at all. Like, they're just like, well, what else can I do? Like, you're telling me I can't run, like, then I can't work out. Like, it's just like, well, then I'm what, a bum on the couch? It's like, well, no, actually, there are all these little other steps that we can do that your body can tolerate. That's going to be those building blocks to get you to that point. But we also can't just jump to that point. We're going to have some big roadblocks and issues and flares and probably big setbacks if we do that. And we also can't just sit on our butt and wait for our body to heal or get stronger or hope it will be ready one day. And, I'm sure and obviously I'm using an exercise as examples, but still even sleep, like you can't just assume you're going to be good at sleep, because you have to have some building blocks there to get you there. And obviously that's where people like you and me come in to have coaches help you, because it is something that, again, even knowing what I know now, it's so helpful to have some outer perspective and have someone see that big picture and be able to say, hey, have you thought about that? And, because I also, I don't want to use myself as too many examples, but I had my own flare recently of leaking. So I had this moment where I peed, I sneezed. I was like, what? Like, this is unacceptable.
I thought this was fixed.
Yeah, I was like, I haven't peed my pants in 8 years. Like, this is unacceptable. And my brain immediately went down, it being my own body as like a patient. I started, I was like, giving myself grief, like, oh, you haven't been working out hard enough. Like, I was like punishing myself, right? Like, my mental state was punishing myself. And then the PT in me had to kind of step back, because it was also a time where it was like allergy season and there was some cold. So I was also kind of low energy on allergy pills and wasn't really going to the gym as regularly. Now, mind you, I still probably went to the gym twice that week. But for some reason, since I didn't make it as often as normal, my head said, you've been lazy. You have not worked out. You are peeing now because you're failing. And I had to step back and be like, hold up. Like, one, strength doesn't disappear in a week. Like there should be no reason why in 1 week strength or weakness is the reason I'm leaking. And so then I had to step back and, using my PT approach, like, okay, well, yes, I've been a little less active, but my pelvic floor from all the sneezing and the coughing has really gotten a beating. So it's probably actually really, really tight. So therefore, my body actually needs some breath work and some release work and some down system or nervous system down training. And I spent just 5 minutes doing some breath work that I used to do very regularly and tell patients to do every single day. But of course, with my busy schedule, that's been pushed off to the side. So guess what? I started to leak. But after one breathwork session, leaking was gone. That evening, I was no longer leaking. Yep. And it was just that reminder of like, rest is important. Breath work is important. Yes. Like I wasn't not doing the right things. I guess I was in the sense that I wasn't listening to my body say, we're stressed. Like we're stressed. You should probably listen. Instead, I was like, I'm not doing enough. Right. And it's so silly that that's where our brain goes. Like even you were saying the mental side of it and how we think about our body. This was such an interesting piece in PT school because when we really got into like nervous system and body image and how people viewed their body, especially with chronic pain, you'd have people, they were drawing pictures or kids that had pain and they were drawing these pictures of their bodies. Yep. And they were so interesting because the parts of their bodies that hurt were sometimes a circle or just like a blob, like they weren't differentiated, right? It was like the right hand, you could see a hand, the left hand was a circle. And it was like literally how these kids perceived their own bodies based on how it felt. And it was so interesting. And then learning the brain and how it actually maps out and smudges certain parts of the body because of pain. And I think that how you start to view your body is so helpful for kind of rewiring that connection and helping your body start to identify where is actually painful, because sometimes your brain's like, I don't know, that space down there. And it's just sending all these pain signals because we've ignored the area for so long. And now everything hurts. And we have to kind of get back in our body and really realize like, what actually is hurting in my body. With that being said, I'd love to know, and obviously in like the physical exercise realm of things, like from your perspective and having worked with all these women with fibromyalgia, what is the preferred type of exercise or movement, or is that just incorporating stretching? Like, is it more low intensity? Like, obviously I have my ideas and what I've learned in PT school, but I would love from like the actual patient side of things, like what do you find enjoyable? And is that, obviously I'm sure there's individuality in there. Like some women are going to love certain things than others, but have you seen any themes of like the body responding better to certain types of movement than others?
Yes, we do. So the first answer to your question is the best thing to do is the thing that you're going to do and that you enjoy.
That you enjoy. I love that. Yeah.
But beyond that, there are some things that do seem to be more helpful or less harmful even. So a couple things for fibro exercise. We do tend to do better with more like strength training, more anaerobic than aerobic. There's a really interesting study done years ago here in Seattle. They were actually looking at chronic fatigue syndrome more than fibromyalgia, and there are some differences. But they actually found that in chronic fatigue syndrome, they would be doing aerobic activities, but it would be anaerobic in their bodies. So they were doing aerobic activities without any oxygen. Oh, wow. Which no wonder that was not good.
Yeah.
So we do tend to do a little bit better. So if you've got somebody who's just, you've been on the couch, you're ready to maybe start moving around a little bit, I would, maybe start with walking, but even more than that, maybe some strength training. And I'm not talking, lifting heavy weights, like, could be body weight even, right? Isometric exercises. So that's one thing. Another thing is that we tend to do better if we keep our heart rate below 65% of our max, which actually isn't very much.
Yeah, that's not.
So if you're using the standard, 220 minus your age, if you're 44 years old, that is about 110 beats per minute, staying
that is not a
under
lot.
that.
Even
right.
walking can do that.
Exactly. Walk up the stairs, it could raise your heart rate more than that. And I think it's really important that we look at what the body thinks is exercise. So I had a client that literally sitting in her bed, sitting propped up, knitting, was an aerobic activity. It got her heart rate into the aerobic zone for her
Wow.
age and body. Yeah. So I think we need to honor that. Right? I mean, somebody who has a body that says knitting is aerobics, we certainly don't want to go do a HIIT training.
Yeah. They're going to hate you.
So if you're listening to this, if you have fibromyalgia and you've struggled with exercise, I would watch your heart rate and start with trying to keep it below 65%. I think walking is fabulous. I mean, it's something we all know how to do. And you can even start as simple as, 30 or 60 seconds, walk around the dining room table a couple of times, and build from there. But we do seem to do better with more, less aerobic things and keeping the heart rate a little bit lower.
That is definitely interesting. Now I feel like I need to take so many heart rates. Like there are probably so many women I've probably pushed too hard. With that being said, how's heat? Like, do you guys prefer, because I think that was something too, I remember like warm water and things like that, like where again, not necessarily swimming, like lane swimming, because that is more aerobic, but even just like water aerobics, like getting resistance with warm water, something that you find more tolerable in that population?
So it's a little bit different for each person. So if we were talking weather, for instance, some people do better in warmer weather. I would die. But if we're talking, exercise, warm pool versus like a not heated pool,
yeah,
we would do better in the heated pool, because you are right about the fascia. We do have issues with our fascia. In fact, myofascial release is one of the best types of therapy for fibromyalgia. And with our fascia being so tight, that warmth really helps get that moving. And so one of my friends who is actually a professional athlete, she said that her warm-up, she has fibromyalgia. She said that her warm-up is what gives her the right to be able to exercise. Because it's that important to warm up our fascia. It's tight. It just needs that softening to be able to move without breaking, right? And the other interesting thing about our fascia, since you brought it up, I know you'll be interested in this. If you look at the fascia of somebody with fibromyalgia, it looks very similar to what would happen with like a bodybuilder. You know how you break your body down and then it comes back stronger, except we haven't done the heavy weightlifting. Yeah. We're just like in this stuck sort of repair that never really finishes. It reminds me of the loading software on your computer, and it says like, it's like at 50%, but then it never moves. Yeah. And so we just never totally heal. It's partly why it takes us so much longer to heal from stuff. So yeah.
Well, and I love that you mentioned the warm up, because I was going to say, I know when I'm working with clients, warming up is super important, because it's that fascial piece where fascia loves rhythm and it loves warmth. And so having that fascial mobility of and if you don't really know what fascia is, any of you listeners, it really is that it's like I like to explain it like the white piece on a chicken, right? That chicken breast usually has that white coating on it. And that's actually that is fascia. That's chicken fascia. But this is just covering every muscle in our body, every compartment in our body, and it is all connected. And the way you can kind of visualize it impacting everything, other than literally just saying it's all connected, like to me that just says, well, then obviously it's going to impact other things. But for some reason there's still this like, why is this happening? Like I had this really neat experience working at a SNF at a skilled nursing facility with a lady that was huge into fascia, and she was a therapist in her like late 60s, mid to late 60s, in the middle of writing a book about like releasing the fascial system and incorporating eye movements. So this poor therapist was the woo-woo therapist at this SNF, because you'd be like, oh, I'm going to go work with the patient that had a total hip replacement. And instead of getting the hip moving, you'd go in and she'd be having them do eye exercises and tongue exercises. And people were like, oh, that crazy therapist, she's doing eye things again. And then I took one of her continuing ed courses, and it just was like, yeah, okay, we might think it's woo-woo, but when you listen and learn, like, it is fascia, like there is literally anatomical connections pulling the optic nerve that engages the fascia down at the leg. Like there are these connections there. And she would be like, yeah, these what people don't want to move. They're in 10 out of 10 pain. And then you get that fascial system warmed up by working on their eyes and their tongue. And all of a sudden their hip moves more. And, you know, I like to think about that as like, you have a shirt, right? And a lot of these shirts have knots in them now. People are tying their shirts up. And if you have a knot somewhere, you can physically in that shirt see those other lines pulling around the back of the body. And that's what fascia is. If it gets tethered somewhere, it's going to yank somewhere else. And then you have this tight saran wrap around this muscle that's wanting to expand and move, but can't, because it's literally being like tethered down by this tight fascia. And so I do think that there is, you know, I'm so curious as the research comes out. I feel like there's going to be so much more, you know, even just as we understand fascia, because fascia in itself was something that even in PT school, we just cut it out. It was like, oh, cut it out, throw it away. And now I'm so sad we did that. Like, I wish we could have actually kept the fascia intact and like seen all of these intricate connections, because we would just cut right through it. Like, where's the nerve? Where's the muscle? Like, we didn't even care where the fascia is. But then you do have these situations where, you know, pain doesn't make sense, or, you know, you're getting all of this tension throughout the body and it's moving around. And it's like, well, what if we actually address the one thing that is fully connected? Like, maybe we'll see a lot of progress. You know, within fascia, this huge study just came out. I don't know, I'm curious if you saw it, that talked about how they're finding that the fascia has more nerve connections than any other part of our body. It holds memory more than any other part of our body. Yeah. Like, we always talk about muscle holding memory, but I'm starting to think it's the fascia the whole time that's been holding that muscle memory. And so I think that in itself holds trauma, right? Like, that fascial system holds this trauma, this stress. And if we're not incorporating that fascial piece, then we're really, really missing the ball. So I'm glad they're coming out with more research and stuff on fibro. What right now are the standard treatments? Because you said they're coming out with research and more treatments and stuff now. What is that standard plan of care for someone if they go in, they get diagnosed with fibromyalgia? What are their options at that point?
Well, so of course, getting the diagnosis is a challenge. And then unfortunately, a lot of times we will have providers who know enough to diagnose, but not enough to treat. And so I talk to way too many people who are like, yeah, my rheumatologist diagnosed me, but they don't treat fibromyalgia. And that's hard. Yeah. So, the standard is there are 3 FDA approved fibro meds. So we've got Lyrica, Cymbalta, and Savella. Those are the 3 that have been approved. And Cymbalta and Savella are SNRIs. So, you know, yes, they are antidepressants. And there's reasons why they work for fibromyalgia pain. It's not just because your doctor thinks you're just depressed. There's actual biology there. Yes. And then Lyrica works more. It's actually an anti-seizure medication. So it works more on your nervous system. Really, really good for nerve pain. Of course, we always want to address sleep, right? Remember, 45% of all fibro people have sleep apnea. So we always want to get a sleep study and make sure that that is being addressed. But there are other things going wrong with fibro sleep. We don't get deep sleep like we should. We have alpha brainwave intrusions into delta sleep. alpha delta sleep. Basically, your brain is still awake while you're supposed to be sleeping. So we need to address some of those kinds of things. Physical therapy is often prescribed, but I always tell my students and clients that if you would be an awesome PT for us, but
Okay.
a lot of physical therapists, it's like, here's the exercises to do. And then you end up in that situation I mentioned earlier. Oh, I could do those, but then I can't drive home. What is much better for physical therapy is more hands-on stuff. So myofascial release, working on trigger points, right? Trigger point therapy, making sure all the biomechanics are right. When you live in pain long enough, you hold your body in funny ways,
Yes.
right? And so getting those things addressed. So PT is often prescribed, but honestly, most doctors just don't know what to do with us, which is really sad. Yeah.
It is sad. And I think that is where we come in, because that's their only well, you're having body pain, so let's send you to PT. But we aren't all created equal. I mean, just like other doctors aren't created equal. And it is unfortunate, because I've even had women go see other pelvic PTs and then come to me and be like, what? Like, this wasn't anything that they did. And I would have never come to anyone again, except for I was in so much pain.
Why didn't anybody
or
tell me
something.
about this? Right?
Yeah, exactly. And so I would just leave that with advocate for yourself, because if you do find a PT that isn't really, maybe they are pushing your exercises and really aren't taking your pain seriously or listening to you, and maybe not doing as much hands-on, which I am. I'm very hands-on. I start out telling my patients, like, don't expect to come in here and exercise, because that's what you can do on your own. Like, I want to cover the things you can't do to yourself.
Yes.
And we'll make sure the exercises are good, that your movement is good, that we're catching imbalances. But that's the work you got to do on your own. Like, we're coming in and we're doing cupping and fascial work and scraping and all of that kind of stuff. And so just knowing that we're not all created equal, and that there are therapists, so that if you do get referred to someone, you can then look and shop around a little bit more. But yeah, I am, again, just so glad you came on the show and kind of debunked some of these myths, because I think that it is one of those populations that get kind of just lumped in with chronic pain, and we're really just like, I don't know, see how they do. And I think that it is something we need to really take seriously. It's a real condition. We're hopefully learning more and more about how that impacts other things and what we can do to prevent or delay flares and things like that. But in the meantime, know that you've got amazing resources like Tami here in your corner, and me as well. And so I just want to wrap up by having you tell my community a little bit more about what you offer and where they can find you and learn more about you and your services and all that kind of stuff.
Yes, I would love to. So first of all, Fibromyalgia Podcast. Anywhere you listen to podcasts. If you're listening to this, obviously you're a podcast person. So that would probably be the best first step for most of you. Just search for Fibromyalgia Podcast. You can also find us at fibromyalgiapodcast.com. And that's me. You'll have some episodes that are just me talking to you, and then there will be other episodes, like we're going to do a swap here next, and I bring experts on to share their expertise as well. So whether you have fibromyalgia, or even if you just think you might and you need more information, that is a great place to start. If you want to go further than that, I do have books. You can download those for free also at fibromyalgiapodcast.com. And if you need that more personalized support, right? Because if you're listening to a podcast, it's one direction, right? I'm talking to you, you're just listening. But if you need a dialogue, we do have coaches. I work with clients from time to time, but mostly I'm training coaches, and we have coaches that we can match you up with. And in a coaching session, what we're doing is we're really helping you look at how you live your life and what tweaks can we make so that you can live a better life. And that might mean things like educating you on treatment options, maybe especially if your doctor doesn't know. We can kind of fill that gap, talk to your doctor about this medication, talk to your doctor about having a sleep study done, talk to your doctor about getting your thyroid tested, those kinds of things. We also all have fibromyalgia, so you're talking to somebody who's been there, done that. And we can give you real life practical tips from the way we live our lives. So it's not just like a theoretical thing, and it's not just a go talk to your doctor thing. It's like, hey, have you ever thought about doing it this way? This is how I do it. Right.
Yeah.
And so that can really be helpful for a lot of people. Our goal is to literally improve your fibromyalgia, not just help you feel better about having fibromyalgia, but help you feel better, right? Less pain, more energy, better sleep, all of that. I also do, like I said, train coaches. So if you're listening to this, you have fibromyalgia and you're like, oh, I want to help people like that too. We do have training programs for that. And you can get to all of that through the podcast website.
I love that. Well, you are doing so many amazing things, and I applaud you, and stepping out into an uncomfortable world where you're misunderstood, I think is, very, very applauding. I feel similar at being in pelvic floor PT with so many doctors being like, that's not real. And I just have to be like, all right, I'm going to have to talk your ear off on this one. I think it's important. We need to step out and really help educate not only women, but providers, because unfortunately we trust our provider thinking they know all things. But I'll tell you, the more I get into healthcare, the more I learn nobody knows much. Like everyone knows itty bits about a lot of things, or if your specialty, you know a lot about that one thing, but your doctor does not know all. So I think that advocating, getting a group of people on your team is very important. And listening to podcasts like this, like you said, with real people talking about their experiences can be so helpful and valuable. So I will have all of her contact information in the show notes, and definitely go check out her podcast. And yes, we're about to go hop on her show and do an interview over there. So go check that out. But otherwise, thank you, Tami, so much for coming on the Balanced Momtality podcast, Pelvic Floor Core and More. So excited to have you. And we will probably chat again soon on this show. I'm sure. I'm already thinking of all the things we could talk about.
I'm here anytime. Thank you so much.
Perfect.
All right, that was so good. I hope you enjoyed my chat with Tami just as much as I did. As you could tell, we could probably chat about things for hours. And in fact, I was on her podcast as well, or I'm going to be if that episode hasn't been released yet, talking about pelvic floor and just understanding more about what you can do, especially with fibromyalgia and the pelvic floor. So if you're curious what my take is on fibromyalgia and things that we can do to help, definitely go check out her podcast and listen to the episode that I'm on over there. But otherwise, please share this episode, leave the show a review if you haven't, and just help us spread the word about fibromyalgia and pelvic floor so that more women don't have to suffer and they know that all of these tools are out there. But otherwise, so excited that you hung out with me this long and can't wait to stay tuned for what's in store next week. I also have more guests coming on the show, so stay tuned. Lots of exciting goodies coming for you guys. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality podcast.